So up next would be the progress note. Now I have admitted a patient, I need to communicate what is going on with them. It's meant to really show the progress of treatment. It is also known as a clinician note or a physician note. There you go. And so the question that asks itself is, what is a progress note? See, the progress note has become now a tool of communicating what is happening and kind of aggregate everything that happens with the patient in one standardized place. But to start off, it may have been just a way for clinicians to kind of document what's going on for themselves and then see the patients from one time to another, revising their goals. Because I'm thinking back in history when it was a patient's file in my clinic. I'm the only doctor in the town, and the patients would come and I just would pull out their file and see what is the last thing we did and what we want to do now. The file would have probably consisted of prescriptions and maybe some images, and there were fewer labs. The progress note has evolved from just being this kind of logbook to becoming a complete documentation system, so to speak. And so what you quickly come to know is that you're going to be communicating the patient's impression, and you want to prove it in an objective way to other clinicians or to yourself and your team in the future. And right now we do a lot of medicine in a multidisciplinary manner. And so you need to be a good historian. So what makes a good historian? Let's ask Google. According to Google, one of key characteristics of a good historian, we're talking about historian, not just a clinical historian, right? Not a physician, a historian. You have to kind of have this objectivity. It is normal for people to tell and interpret history from their own point of view. However, historians must maintain a level of complete and total objectivity and simply refer to facts, and avoiding opinions of any form and any form of bias. Now, in our clinical notes, we will be giving our opinion in the form of assessment, and our assessment should be based on some of the facts that precede. And so now you start to see more how there's a need for standardizing the way that we prescribe or the way that we describe the data in our progress note and how it flows. However, there remains to be multiple formats, and the idea is there. Interestingly, Google suggests on its own what skills do you need to be a historian, and analytical skills, communication skills, problem-solving skills, research skills, and writing skills. And boy, oh boy, are these skills that are needed by a physician. And one of the questions that did ask itself, kind of pressed itself on me, is who invented the progress note? Now, what I do know is that the modern SOAP note was invented or kind of proposed by Larry Weed, or rather Dr. Lawrence Weed, almost 50 years ago, as you can see in this article. He called it the problem-oriented medical record, and his idea was that we were going to kind of give a full cognitive framework of our clinical reasoning. And that made me so happy to read, because I always feel inclined to explain why I think this and that is and isn't so, and it really helps me to objectify how I treat my patients. And I have been blamed for writing lengthy progress notes, although I try to limit myself to 1 and 1.5 pages. But some people don't like that. But there is a root to where that comes from. So you want to guide the health workers, use their clinical reasoning to assess, diagnose, and treat patients based on the information provided by them. SOAP notes are essential pieces of information about health status of the patient, as well as communication document between health professionals. So I advise you to go and read this article from Stat Pearls. It was a nice read. So Dr. Lawrence Weed, I believe that he passed away in 2017, also proposed that a patient must have a copy of his own record. Your health, your problem, your plans, your progress, right? This is from 1975, also derived from Google. An excellent example of a good initiative that really made a difference in the way that we practice medicine. So I argue that you should mention all of your thoughts clearly in a progress note. So you mention your thoughts, but you make sure that these thoughts are based on facts, i.e., to maintain objectivity, you write the fact and then mention what it makes you think of. It makes me think of possibly this and that. And then you kind of boil that down to your assessment, right? And facts can be subjective and can be objective. Objective would be the ones that are measurable in hard data. And so on daily basis, your assessment will show how your diagnostic workup has evolved and what can improve. We must be careful of labeling patients. And that's why understanding that when you write your thoughts, you should mention that my assessment is I'm thinking of, I'm working on, and not diagnosing this to be that or that. So you have to be very careful in the assessment field. I'll show you now examples as we go down to really discussing the format of the progress note and giving an example of it. So please be careful of labeling patients. The only rule that I'll mention in this video is rule 1. The first and most important is do not diagnose unless you diagnose. So don't throw labels again. And what that means is instead of using the term diagnosis or just using the term, the clinical term, as in this is an enteropathy, even though that is a general term, right? Try to put query diagnosis of enteropathy for workup, working diagnosis of whatever, right? And then kind of mention what then you need to do in general and detail that in the plan. The modern progress note has special properties. You need to include the time, the date, the note field, which is the actual field that the note is written on, right? So this is a note field. You can see multiple examples of progress notes from different institutions. And so you can see that as well. And the signature or the insignia of the doctor, whether it's an electronic or a paper record, of course, identification of the patient, and then special institutional labels. See, some progress notes will also include where the patient is or where the note is taken, and some special forms would be for clinic, others would be for inpatient, and so on. So these are examples of progress notes and how they look like. Electronic progress notes use the same data and structure as the things you see here, but obviously there are many different formats of the system, so they're going to have the same components that we mentioned above in blue, but this is an example of what an electronic progress note is. Now, electronic progress notes help us by providing the possibility of templates. For example, this is a mental health progress note, right? And so you can see things about goals that you may want to give to a resident in an institution, in a mental institution, for example. She'll stop being threatening and so on. These are things that you can kind of choose from a template, and then you can write your field, and then you have also your identification, time, etc. And because it's written through special logons, and then you have the insignia of the doctor instead of a manual signature or a stamp and signature. This is likely a good time for a disclaimer. You have to be sure to follow your institutional policies and procedures to complete an accurate medical record, because they might need you to fill out certain things. You should note that improving quality of record and ensuring certain issues are addressed and documented in certain formats have been added in addition to progress notes. So the most striking ones would be the venothromboembolic risk and prophylaxis and fall risk stratifications assessments, and then plan. And such additions are also standardized and monitored. Monitoring can be by institution or governing bodies and accreditation societies such as the JCI, for example. This should give you an idea of the magnitude of the importance that is placed on the medical record. A progress note is a pillar of said record, right? You remember that now we have to look at what a progress note looks like in terms of how Dr. Lawrence Weed kind of proposed. So first off, we're going to identify the patient, and then after the identification and doing all of that, all of these data may be needed: date of birth, full name, gender, allergies, etc. Then we're going to go ahead and kind of start a sample note. So we're going to date and time, and we can go ahead and say a 45-year-old man with diabetes controlled on metformin and diet presents to our emergency room with 1 day of shortness of breath, admitted as a case of pneumonia. So this is a background. Subjective, the patient feels fatigued, tired, restless, and worried. He is coughing and has some throat discomfort. Objective, vitals, level of consciousness, level of distress can all be mentioned. And you mentioned full vitals, that includes your level of consciousness, your random blood sugar, etc. And then you do like a head, ear, eye, neck, throat examination, if it's normal or not, in detail. And you do a chest and cardiac examination, you write the details, and an abdominal examination. And these are all objective things, you write the details, right? And then ETC, you do the necessary, and then you can go ahead and write a chest x-ray showed, an ECG showed, labs showed, and then you write all of those objective data, right? We can also add things like the VBG, patient on meds, and I list the medications and dates that antibiotics started and so on. And then I write my assessment, community acquired pneumonia, because I'm sure I have diagnosed, I'm not working on it, right? And I can say, for example, meeting definition criteria for example, MERS-CoV, should the patient have had certain criteria. Because this is assessment, obviously you'd expect to add what kind of made him define the criteria. For example, contact with camels 5 days ago, right? So that means I can investigate for Middle East respiratory coronavirus syndrome. And then plan, and you kind of detail the plan objectives without specific doses. I don't, some people will write, but I write generally what kind of antibiotics, isolation, etc. I'll mention what kind of antibiotics, the names, the kind of isolation, the kind of supportive care, the kind of non-pharmacologic therapy, and then I'll see order sheet. And then I'll detail, as I mentioned in the order sheet video, all of the things that need to be done. Then I will sign and stamp. And so you should you write a full background of the patient every time? Well, it is important to remember that you govern your notes. They don't govern you, right? This is an important question. I can write the simple progress if I am sure that the note that has the details is actually accessible. And I can write an order to actually keep a certain note in file, because some files need to be thinned out as they grow and they are physical files. On file, some systems will allow you to pin a note at the top so that it's not lost, or at least copy paste important background information so you can have a background section like I always do before the word subjective. In line of Dr. Lawrence Sweet's problem-oriented medical record, and I really like how he made this name, but because now we have a complete medical record, a whole file that has multiple sections, we like to keep the name progress note for the note, or physician note, or clinical note, etc. Here is an example of an actual progress note that does not follow SOAP, but does follow the problem-oriented medical record kind of schema of keeping a full, integrated, objective way with a cognitive reasoning path or so on board. This is a modified progress note to maintain confidentiality, obviously, akin to the actual note of mine to an actual patient of mine. So this is February 33rd of the year 1020. And you can see what I choose to do here is, let me zoom in a little bit. I choose to say, okay, the background of the patient, and I'll write the background because this is a long-term patient of mine, and I'll write the backgrounds all as is. And then I'll actually define which ones of them are active, including new issues, right? So I'll just have my active issues. Sometimes I'll actually like to number them. And then that would clarify what things I really need to be addressing in my assessment. in addition to any background issue that needs continuous kind of monitoring, things like, for example, sliding scales or ongoing antibiotics or chemotherapy or things of this sort. And then the medications, because this is an important thing. This is a long-term patient might get an addition, for example, of an antibiotic that might have an interaction with another medication or an acute issue that might affect the metabolism of a certain medication. And then I'll write the newest investigation, and I'll keep important baselines if it warrants to be so. I'll always try to keep a complete list of all the cultures and dates for patients because that helps me know what colonizations they have. And I'll write the medical images for the patient. Again, in date, I'll try to keep a complete list, a comprehensive list that makes sense to follow on a progress note. So these are the complete list of investigations this patient had. And then my plan. And this is an actual note that is not the keep and file. There's a more detailed note before that explains the social aspect, the resuscitation status, the family meeting. But this is a note that is one page that has a complete idea of what I need to keep in mind for my patient. So other formats of progress notes exist? Yeah, some formats do. So if you ask Google other formats of progress note, it'll suggest SOAP and SOAIGP and DAP. So SOAIGP is supplementary data, observations, activities, impressions, goals, plans. Some of the senior nursing staff that I know actually like to use this format. DAP or DRP even, Data Assessment Response Plan. I've seen some of our social workers use this format. And so these are all formats, but you see at the end, the data can be subjective and objective. And so SOAP, right? So you can always fit the same ideas in the same way. You just need to know how to use it. So in conclusion, you don't have to stick to a mechanical way of writing a progress note, but you have to make sure it is a comprehensive, accurate way that helps in cognitive reasoning and following the evolution of the clinical picture of your patient so that the patient will be able to do better. And on that note, thank you for watching.